Papanicoloau Test. The Pap smear, also called the Pap test, a procedure to the test for the cervical cancer in the women. Pap smear involves the collecting cells from your cervix, the lower narrow end of the uterus, that is at the top of the vagina. Pap smear is an example of the secondary level of the prevention. Screening of the cervical cancer at the PHC level is done by the Pap smear. Uses. A Pap smear is a screening test for the diagnosis of the cervical intraepithelial neoplasia and the carcinoma cervix, reduce the incidence. Trichomonas vaginalis, candidiasis, bacteria vaginosis, astromeiosis, Herpes simplex virus infection, human papilloma virus, inflammatory changes. Cellular changes associated with the radiation, cellular changes associated with the intrauterine devices, glandular cell status, post-hysterectomy and atrophy. Indications like all women greater than 2 years, all women 3 years after the onset of the sexual activity, women with unhealthy cervix and pregnancy, and with the intramenstrual bleeding or the discharge. High risk cases like a woman exposed to the early sexual life, multiple sexual partners, multiple of the women with the HIV, HPV, or the Herpes simplex virus infection, and smokers. Techniques. The speculum is introduced in the vagina without the lubricant, and the material from the cervix is collected using the A spatula. Pole of the squamo-columnar junction has to be scraped. Rotate the scapula through the 360 and spread it on the one side. And the material is also collected from the posterior wall of the vagina, which acts as a control. The glass slide is not hard as it gets damaged. The slide is fixed using the ethyl alcohol. The main problem with the conventional Pap smear are that they are the variable thickness and may get obscured by the mucous plate and the other debris. This results in the cell and the nuclei overlap, causing the problems with the detection and the interpretation. To overcome the problem, liquid-based cytology has been developed. 3 types of cells, basal and the parabasal cells, cells from the middle layer and cells from the superficial layer. Pacnoctexillum. Papno classification: grade 1 normal cell, grade 2 slightly abnormal, grade 3 a more serious type of the abnormality, grade 4 distinctly abnormal, grade 5 malignant cell seen. Pap smear is useful in the diagnosis of the trichomonas vaginalis, HPV, and the inflammatory changes. Women greater than 20 years, pregnant female, sexually active female are all indicated for the Pap smear. This is a pregnancy routine as a part of screening can detect the SIMA. This reduces the incidences of the carcinoma cervix. Poilocytes with the perinuclear halo on the Pap smear is the pathogenic of the HPV infection. Most commonly demonstrates the protozoal parasites, Trichomonas vaginalis in the women. A female presented with the post-coital bleeding can be managed by the Pap smear and the colposcopy. This is an example of the secondary level of the prevention. Screening of the cervical cancer at the PHC level is done by the Pap smear. Sensitivity of the conventional Pap smear is picking up the cervical cancer 80%.